Now to the impact of COVID on classrooms in Idaho.
CBS 2's Ariana Piper investigates how school districts collect COVID case data.
Here at the Idaho State Board of Education, a spokesperson tells me right now there is no state standard method for reporting COVID-19 cases in schools.
The Chief Communications Officer, Mike Keckler, says schools and districts work with their local health department to determine how to report cases.
We're right in line with the guidance from Central District Health as it relates to quarantining. We're very strong in that regard. We're very aggressive when it comes to quarantining. So people need to take that into account when they look at our numbers.
Dan Haller, the public affairs administrator for the Boise School District, says the schools notify the district of a positive COVID case. The district then tells Central District Health, and finally, the district posts this information on a COVID-19 tracking sheet.
The vast majority of the cases that we are seeing are from the community.
Here at the Boise School District, positive cases are reported regardless of if they take place inside or outside of the school. But for some districts, that's not the case.
Over at West Ada School District, they do things a little differently. Positive cases reflect those students and staff that were infectious only while attending in-person school. A spokesperson says school nurses input positive cases that are reported to them via parents, and that information is captured in a district database. Similar to the Boise School District, the Caldwell School District reports positive cases regardless of where the student or staff was exposed to their local health district.
If they do test positive, they will begin the quarantining process along with contact tracing for other close contacts, and we report our numbers.
Each district seems to report numbers a little bit differently, but will that affect the accuracy of the data?
Central District Health is looking to create a more standard method of reporting by asking districts to use the same exposure form.
The exposure form recently went live on Central District Health's website. A spokesperson says this form is for school administrators, nurses, and school points of contact to submit known school exposures. This form is not for parents or guardians to submit when their child has been exposed at school. Central District Health says it is also making contact tracing in schools a priority. Ariana Piper, CBS 2 News.